Hello, thank you for coming and watching my presentation about chiropractic care in the primary care setting. So this is a patient case introduction. This is a 45-year-old Caucasian male. He is a stonemason worker. He has low back pain with radiation to his right leg, and he came requesting an oxycodone prescription. Now this patient reports a 3-week history of intermittent low back pain localized in the lumbar region with radiation down his right posterior leg to his calf. Stolen aching at rest with movement. It's 10 out of 10. It's very painful. He has been using over-the-counter NSAIDs, and he doesn't really show any symptoms of cauda equina. And he has been seeing a chiropractor. He sees them once every 2 weeks. He's only gone to 2 visits. He doesn't want to go any more than that. And the chiropractor requested 3 times a week for the last 6 weeks. And he overall is just not feeling well. He recurrently hurts his back with his job, and as you can see, there's my differential diagnoses and general physical exam findings. So a traditional Western approach to this, I got this from the American Family of Physicians. I want you to notice there's not chiropractic written on this, and we basically did everything. We ordered an MRI of the spine, even though this is more fresh, due to the fact that this is reoccurrent. And we encouraged stretching, light activity, core strengthening, heat and ice. We did prescribe a prednisone burst, meloxicam, Tylenol, baclofen, PRN, and oxycodone was not prescribed, and he was educated as to the dangers of it. He didn't realize those. So with this patient, I feel this was more of an education consult. With this, we expect often improvement in 6 to 12 weeks. We explained to him the signs and symptoms of cauda equina and instructed him to go to the ER if he experienced those. And we educated him to DC all NSAIDs. He was to continue in 4 weeks or sooner if he worsened or had any neurological changes. And something about this patient is he is a cash pay patient. He did decline being referred to physical therapy, but we did have that in there just in case he changed his mind. He could always call us up and go. So what is chiropractic care? So I got this from the Arkansas State Board of Chiropractic Examiners. Essentially, they diagnose and analyze any interference with normal nerve transmission, and is treated by adjustment of the articulations of the vertebral column and its immediate articulations, spinal adjustments, spinal manipulations, and spinal mobilizations. I did a list of things that chiropractic can treat. Some of them are controversial, but it's been found to help in pregnancy. For example, there's a maneuver that is done that has an 82% effectiveness in turning breech babies. In newborns, torticollis is often treated, and chronic bilateral ear infections are often treated, and it's found that it helps with the chronic ear infections due to the neck from a traumatic birth can be essentially out of alignment is the thought, and it's not draining correctly due to the fact of things not being aligned correctly. Treating newborns is something that is controversial. Chronic back pain is the bread and butter of chiropractic. Whiplash and car auto injuries are often treated. And recently, it has been found that chronic spinal adjustments have been shown to result in short-term increases in muscle strength in chronic stroke patients. And this was a double-blind study that was shown. One was just physical therapy and chiropractic, and one was a pseudo-chiropractor and just physical therapy, and it was found that the ones that experienced actual chiropractic care had over double the increase in muscle strength. So what do chiropractors do? They do spinal manipulation. And so those are a ton of the techniques. I just listed some of them. I'm not a chiropractor, so I'm not as familiar. They work in nutrition, physical therapy, home exercises. They practice electrical stimulation. And they participate in a series of 4 national board exams to become state licensed. They're educated at a nationally accredited 4-year graduate program, which is equivalent to that of a MD or DO in amount of time that it takes for them to go through their program and classroom hours. So, where did chiropractic start? The term chiropractic comes from the Greek word share, hand, and praxis, to practice. It describes a treatment done by hand, originally from the art of bone setting. This is practiced with and without training. Bone setting, not chiropractic. So bone setting is a folk art. It's been found in Egyptian manuscripts. There's a religious institutions would practice it. Friar Moulton in 1656 wrote a book called Complete Bone Setter. It's presently in the library of the Royal College of Surgeons in England. There are records of similar therapies being done in the Native American tribes, Aztec doctors, German folk medicine, and most notably Hippocrates. And many of Hippocrates' techniques are still used today to reduce fractures and to practice manipulations. Modern chiropractic is noted to have started in 1895, approximately 21 years after osteopathic medicine was founded. It was founded by D.D. Palmer. He was a magnetic healer in Davenport, Iowa, and he stated he discovered chiropractic. So, is chiropractic evidence-based? I would argue yes, it is. Among Medicare beneficiaries that receive chiropractic care for a neuromuscular problem, they have a 76% lower injury rate than if they went to a primary care physician. But that's just injury, right? Like, it doesn't mean they're getting better. At least they're not getting hurt, right? So, a retrospective study was performed by Blue Cross Blue Shield showing that chiropractic care had a 40% less cost to patients than starting with an MD for lower back pain. So if you see a chiropractor first, you're going to have lower costs and have a resolution per the study. These patients were very happy, they had high satisfaction scores, and they felt the problem was addressed. It's been found that patients are half as likely to fill an opioid prescription if they receive chiropractic care. This patient that we had, he wanted an opioid prescription, but was he compliant with his chiropractic care? The answer is no. Okay, and this other study shows clinical and cost utilization. So it's over a 7-year period. It was the same location. So these patients, they're contrasting those who went to chiropractor regularly and those who did more traditional. Well, chiropractic care, if you think of it for how long it's been around, is more traditional, but the more Western medicine based. And it was found that they had 60.2% less hospital admissions, 59% less hospital stays, 62% less outpatient surgeries, and their pharmaceutical costs were 85% less than their peers. Overall, it's been found that healthcare costs are reduced for chiropractors, for those who receive it. And patients overall have a great satisfaction. They feel like it works, which is the most important part. Now, here's the beef. Chiropractors and the medical establishment have long not gotten along. In 1987, the United States judge, Susan Getzerdenner, I can't ever say it right, found that the AMA guilty of violating the Sherman Antitrust Act. She stated that the AMA was decided to contain and eliminate chiropractic as a profession, and that the AMA was intent to destroy a competitor. And in those past results, that's a lot of money that's being lost by the medical system if somebody goes to a chiropractor. So there's finance. There is some validity where initially in the initial start of chiropractic, it was a starting science, and so there were some things that are not necessarily evidence-based that were done. But over time that has resolved, and like any profession, it's going to go through growing pains, and it's going to go through learning, and it's going to learn how to practice medicine, because medicine is a practice. We're all learning how to do it, and the physicians are just as guilty as the chiropractors of practicing to become better. So now the American Medical Association no longer opposes chiropractic, but permits physicians to associate with chiropractors and refer patients to them for care. Historically, the AMA actively fought against chiropractic, considering it a, quote, unscientific cult, and, quote, attempted to eliminate it, and later found to be an illegal conspiracy. The modern AMA policy allows for, quote, ethical collaboration, which is a loaded word because they also had ethical boycotting at one point. So there is still some active opposition toward chiropractic, and it is a barrier for collaboration, especially for musculoskeletal conditions, but the AMA still advocates for physician-led care and opposes broad expansions of non-physician scope of practice. which we also see as nurse practitioners, that they are not too friendly with our scope of practice. So they would do this by opposition propaganda. They had a committee they called the Committee on Quackery, which was their sole job was to discredit chiropractic. They did ethical boycotting, as in they did not play with chiropractors in the sandbox. They would not refer, and they would not take referrals. And this is still a struggle to this day. So we're going to keep going, and we'll talk a little bit about some of the series of events that occurred. So chiropractors' first challenge as a profession was to gain licensure. The AMA actively advocated against them gaining licensure, and they would be imprisoned for practicing medicine without a license. However, a chiropractor purposely went into Wisconsin, and essentially with the idea of having a positive legal ground, and was able to win a court case after being arrested. And that was the famous Wisconsin versus Markobu case. In 1913, the first chiropractic board was established in Kansas, and the AMA advocated adoption of what they called a basic science examination. And that's all doctors had to qualify for a license. These exams were heavily biased toward those standards of medical training, and since chiropractors received no training in medical procedures such as surgery and obstetrics, they were unable to pass. We see that DOs are able to pass these exams, but it's at the cost of in order to learn that, they did have to drop certain parts of their education, is my understanding. So it became more standardized to the standard medical training. So chiropractors found it nearly impossible to pass the exam or gain licenses, and with that, from 1929 to 1950, not a single chiropractic license was granted in the state of Nebraska, for example. So this continued. The AMA actively advocated against legislatures to limit practice and what they called a regular practice, which isn't very scientific. It wasn't very collaborative. And this led to the golden age of doctoring, which lasted in the 1970s. The AMA also hired ghostwriters for television and movie scripts, as well as widely read newspapers and other media outlets to tarnish the reputation of chiropractors in the public eye, and I believe this is still ongoing today. If you ever watch the show 2.5 Men, the brother that's the dweeb, he's a chiropractor, and he's painted in a very ill light, unable to do anything for himself, unable to have a home. He's seen as a parasite, and I don't think that's an accident. The AMA even encouraged the distribution of anti-chiropractic material to high school guidance counselors so they dissuade interested students from pursuing a career in chiropractic. So that's a lot of negativity toward this profession and not a lot of collaboration. So what are some different practitioners that practice spinal manipulation? So osteopathic doctors practice spinal manipulation. They receive about 200 hours of training. Physical therapists claim to practice manipulation. However, their training, I've searched around a lot, it's not really standardized. They are taught in graduate school anywhere from 1 to 10 lecture hours and 10 to 20 lab hours. In some states, such as Washington, they need at least 250 hours to practice any of those manipulations. So that's when you become a osteopractor, and that's a physical therapist or medical doctor of osteopathic medicine that has completed an evidence-based postgraduate training program. And it's regarding those, and it can be anywhere from 68. And I was looking at some of Thomas was the source, was one of the trainers for this program that was accredited. It can be anywhere from 68 to 178 hours. Some practitioners will have more. It's really important to know where and how they were trained. And so it's just simply different. And then medical doctors are not, unless they get this osteopractor licensure, they are not trained in spinal manipulation. So what's the plan of care? First of all, it's just important to be open to giving a referral and receptive to collaborative care as nurse practitioners. To understand that injuries are going to be graded differently, so they're going to be given different treatments. Treatment times are going to be affected by complicating factors that affect healing, such as is the patient overweight, are they diabetic, Are they a smoker? Do they have an autoimmune disease? And these all affect timelines. And it can be anywhere from 3 to 12 weeks for a chiropractic adjustment, with the average being 6 weeks. They typically want to start out seeing them 3 days a week. If it's an injury they're trying to correct, much like braces, anytime you're working with bone structures, correcting scoliosis, you need to do it over long periods of time, and it needs to be consistent in order to make a change, or else it'll just go right back to wherever it was. And outcomes are better with more frequent visits initially. And so with this, I have the 3 phases of healing. It just is reminding how the body heals. Inflammation occurs in 4 to 6 days, and that's often when ibuprofen can be really effective, all those NSAIDs. Then proliferation, where that's where the scar tissue is forming, and then it goes into remodeling, where the body is changing into either protective, or there's different ways of going about it. And so that remodeling process is something that chiropractors are trying to be a catalyst in, to have the body remodel in a more positive way. Okay, so risks, contraindications, and challenges. So we discussed how the AMA was actively discrediting chiropractic. I think it's still going on today. If you look at this YouTube short, it's of a emergency medicine doctor stating he would never allow a chiropractor to adjust his back and his neck because of things he had seen in the ER. And that is his experience, so you can't discredit his experience, but there was no sources cited. There's several videos like this of different physicians stating they would never let a chiropractor touch them, but then they don't cite any sources regarding studies showing that these techniques are invalid. So that is where I get my issues with. If they have an experience and they have a case, that's understandable. But if there's no sources or abilities or studies showing that these are negative, then I have a hard time crediting it. Something that they'll often talk about is vertebral artery dissection, especially with neck adjustments. And that has simply been found to be false. I found several studies that show that it's more of a correlational than a causational relationship, that the association between chiropractic and PCP visits before this stroke or vertebral artery dissection are similar, and they're likely seeing the patients because they have early dissection-related symptoms. So if you have a headache and in the past you've gone to a chiropractor and you get your neck adjusted and your headache goes away, you're probably going to go back to your chiropractor again if you get another one, and just to have it be cared for. And so oftentimes it's the process. So the biggest side effect I could really find that had some validity was soreness after adjustments, which is normal if you're stretching areas. There are other issues that can occur if chiropractic isn't applied correctly. That's just like any therapy. And the important thing to note is that these are trained individuals, and if they shouldn't be doing something, we should trust that they will know not to do it. So we'll keep going. So patient education and shared decision making. So how do we find a good chiropractor, right? It's hard to tell. I don't know. So just look for somebody who has a diagnostic imaging in their office or does diagnostic imaging before touching the spine. So for example, do they take an x-ray and kind of look at what's going on? Because there are some contraindications, such as, do they have cancer? Do they have severe osteoporosis? There are going to be things that should be managed differently too. It's not saying that necessarily all the time those patients shouldn't receive an adjustment, but it will be needing to be augmented based upon their presenting symptoms. Look for somebody who has a team approach. If it's Mr. Wonder Boy and he says I can fix it all, they can't fix it all. That's not safe of any provider to state that they can fix every malaise. And that's not just for chiropractic. That's any specialist, that's any family medicine doctor. We need each other. And then look for a doctor who has a few years of experience and ask around and look for references. Has he had good outcomes, or she had good outcomes before? So the case outcomes was with recurrent chiropractic visits, this patient found relief and they no longer required medication. So it's important to educate patients why it's important to do the recurrent visits. A lot of people try to sidestep it because it's a lot of work, and that's why chiropractic isn't for everyone. The rehab process is work, and it does require frequent treatments, but So is the rehab after surgery or any of those things. So the work is going to be there, but sometimes people are just only ready for Band-Aid solutions. And so there's going to be different therapies that are going to be effective for everybody. It's a case-by-case basis. And not all insurances cover chiropractic. So cost-wise, this, depending on the person's budget, this may not be for them. So these are questions for discussion. I would love to hear your thoughts, and I really appreciate you listening to my presentation. Thank you.